Hello class, my name is Emily Parsons, and for this week's discussion post, I will be discussing integrity related to the nursing profession. According to the student handbook, integrity can be defined as respecting the dignity and moral wholeness of every person without conditions or limitations. Nurses who have integrity strive to provide the best care for their patients. Nurses can show integrity by being honest, dependable, reliable, respectful, and accountable for their actions. Showing integrity through your nursing practice has been shown to have positive impacts on patient outcomes, and this creates a better work environment. Those who lack integrity have poor relationships with their patients and coworkers alike. This could create more stress for the nurse and cause less favorable outcomes for the patient. As a nurse, I take pride in my job, and I look up to those who value integrity. However, I can understand how certain circumstances can make even the best nurse question their integrity. For example, whenever I take an assignment on a patient who is a justice-involved individual, I know to tell the person giving me a report not to tell me their background as to why they're in jail. Not that this relates to their hospital stay or the care that I'm providing, but I know that certain nurses like to look up that information. And I know personally that it does not benefit me to know that information. I know that if I were caring for a patient that did certain crimes, such as harming a child, I could not provide the best care that I should. Instead, I would become biased, and that's not the type of nurse that I choose to be. I want to uphold my integrity and provide the best care that I can for my patients, regardless of the situation or their background. Stressful situations can also cause a nurse to lose integrity. An example of this would be life-ending or life-prolonging choices. Not long ago, I had accepted an assignment on a patient who was in her late teens. She had just received her first car and was involved in a motor vehicle collision in which she sustained a traumatic brain injury. Her best Glasgow Coma scale during her stay was 6. The family chose to continue every treatment possibility available despite knowing her condition would not improve. They even went so far as to buy her a new car so when she got out of the hospital, she could start driving again, which is never going to happen. I felt guilty for taking care of this patient, knowing that she would spend the rest of her life living in a skilled nursing facility, bedbound, and unable to communicate. She was also contractured by the end of her stay at the hospital. She was stuck in her own body at such an early age, and this caused me severe moral distress. Nonetheless, I persevered and upheld my integrity as a nurse by providing the best care that I possibly could for this patient. She was not my family member, and it was not my choice to make these medical decisions for her. To conclude, I believe that showing integrity as a nurse is one of the most important and sought-after characteristics that one could possess. Thank you for listening to my take on integrity, and have a good day. Thank you.